I became involved with ISD at the very beginning in 2009. This was an initiative that was developed by 4 government departments: education, health, social development, and public safety. And the intent was to look at how we could shift the way we deliver services to children, youth, and families, and work from a more collaborative, integrated approach. Having worked in addictions and mental health for many, many years, ISD was an exciting way to rethink how we provided services to children, youth, and families. The intent was that the 4 government departments would come together and develop a collaborative plan for youth requiring services, as opposed to each department having their own service delivery plan.
Within Horizon, our clinical team is pretty broad, but it also includes a support team. So we have trained psychologists, psychometrists, we have human service counselors, occupational therapists, physiotherapists, social workers, and men's support staff, and clinical coordinators who are all part of this very important, complex team looking after kids. Our responsibility in integrated service delivery is the lead clinical role. So we're very much involved in coordinating the care that children and youth bring to the table. So basically, integrated service delivery is what we've done from a bureaucratic perspective is to take away many of these hurdles where children and families get to have rapid access. They have to tell their stories as few times as possible, and we make access as simple and as easy as possible. So the name is not as important as the fact that they know they can get help. Often in the schools, what we've done is move most of these clinicians into the school environments where kids are at most of the day, and it makes the access a whole lot easier. So when people are needing help, the children and youth teams that are established in these schools and in these areas, these clusters, are able to respond quite rapidly.
It was in 2017, our son William, who has autism, was really starting to struggle in the school setting. He was not doing well, and so things had begun to disintegrate, and we were at the point where we were really unsure of what was going to happen next. It was brought to our attention that there was an ISD program and that they thought it would be something that would be helpful. And so we sat down at a table together and we began to just put on the table who William was, what his struggles were, and what could we begin to do as a team for William to help him begin to function and to help him succeed. We began meeting regularly and setting goals and just always checking in to see where progress had been made and where there was still challenges, and we continue to meet till this day. And we have come to a point where he is in class the majority of the time. He is functioning and participating at his level, and we have put into place a really good system that works for him, and we have seen so many positive changes. Well, it's life-giving, because to see him thriving and to see him achieving things that he wants to do, and to see him doing the things that make him happy, it's the best gift that we could have ever received.
I've been around a while. I've worked in a few different elements of Horizon, so inpatient and outpatient. There's definitely some real positives that have come out of the ISD model, and specifically working in the child and youth team. I think the biggest thing would be collaboration with the different departments that are working kind of for the best interest of the children and their families. There's definitely also youth and families we've been able to engage more effectively because we've been encouraged to engage more at a community level. So specifically older youth, it's like 16 plus, who would have transportation issues. We're able to see them at school and provide them with intervention kind of on site.
This partnership is the critical ingredient. This is not only the regional health authorities, it is the Department of Health, it is public safety, it is education, and it is social development. So these are important departments that often work in siloed because of the way we were structured. Integrated service delivery has actually taken away those silos and permitted what the clinicians have told us for a number of years they wanted, an easier way to make things happen to help kids and families.